As Lee told you, my name is Dr. Julia Scalise, and I'm a holistic health consultant and an energy work practitioner. Slide's not working. It's not switching. Okay, there it goes. A board-certified member of the American Association of Drugless Practitioners. I'm a member of the American Holistic Health Association, certified member of the American Association of Nutritional Consultants, a certified physiological regulating medicine practitioner, and a certified practitioner of integrative energy therapy and Jinshin Jitsu Level 2 self-healing. I am a practicing naturologist, and naturology is nothing more than the study of nature as it applies to the health of humankind. I use nothing artificial, and basically I try to address causes versus symptoms. I'm not a practitioner who likes to put Band-Aids on bleeding arteries or pour water in buckets with holes. It does not serve anybody well if somebody comes to my office and they're on 10 medications to send them home with 10 supplements. I really want to get to what's causing the disease or the lack of harmony in their system and get them better. The most frequent complaint that I hear, other than I can't lose weight, is I'm sick and tired of feeling sick and tired. And in the course of my academic training, my personal experience and clinical experience, I know that lack of harmony or disease can be traced back to pretty much these four main topics. Tonight I'm going to discuss toxins, stress, and other, and not going to discuss genetics too much, because it's a very complex topic. There's not enough time this evening, but just know that more and more we're finding out that when someone is genetically predisposed to something, we need to have a switch to turn something on or off to make it manifest. For instance, multiple sclerosis, they're finding that Epstein-Barr virus may be an underlying cause in that particular genetic group of people. And people that are now showing a lot of insulin resistance, metabolic syndrome, they're finding that chronic inflammation, chronic infections, which is upregulating some of the interleukins like interleukin 18, interleukin 6, are changing receptor sites on cells and making insulin resistance and metabolic syndrome more prevalent. So again, genetics, a little bit too complicated for tonight, but we know that they do contribute to some of the illnesses. When I talk about toxins, I talk about yeast overgrowth. I'm sure some of you are very familiar with Candida. A lot of the other pathogens that I see very frequently in my practice are chronic viruses like Epstein-Barr virus, cytomegalovirus, different types of fungal infections, parasites. And I'm not just talking about pinworms and tapeworms and roundworms. There are parasites from mosquito bites, insect bites, chiggers, flea bites, those kinds of things. There's liver flukes, lung flukes, and also there's chronic bacteria, some of the bacteria that can't even be addressed today with antibiotic usage. Some other toxins are, of course, food sensitivities. You're all familiar with that, or else you probably wouldn't be signed on tonight. Heavy metals, such as mercury and lead, and then there's the environmental and chemical toxins. A study was done about 10 years ago, around the year 2000, and they found out that there were 287,000 more chemicals in our atmosphere than there were just at the end of World War II. And a more recent study done on fetal cord blood shows that there are about 300 toxins being now found just in fetal cord blood alone. That's pretty scary because we're now being exposed in utero. Some of the other things that can affect your clients or your patients and continue to make them feel sick and tired all the time, aside from the physical stressors that I just talked about, of course, are emotional stressors, and then the environmental stressors such as the electromagnetic energy that we're constantly being bombarded with today from computers, cell phones, any of the other electronic devices. And this is ongoing again. You know, if we can't start to pay attention to what's in our environment, what we're putting in our body, and start to get rid of some of these toxins, you're never going to get your patients better. This is not changing over again. Sorry about this, folks. A recent survey was done, and they found out that The average level of stress when compared to our Victorian counterparts revealed that we experienced more stress in 1 year than our counterparts did during their entire lifetime. As we all know, stress really depletes our immune system. Stress hormones versus immune hormone production, there's a constant battle going on. And basically, you're trying to use one army to do two battles. That can really wear you out. Stress definitely disrupts our energy. In the energy work that I do, some of the emotions that we look at are worry, fear, anger, sadness, and pretense. And each of them are connected to specific organ systems and disruption in energy flow causing problems. Worry addresses the spleen and stomach, which could also be the immune system. Fear will manifest in kidney and bladder and adrenal issues, sometimes muscle issues. Anger can affect liver, gallbladder, and blood. Sadness can affect lung, large intestine, deep skin, connective tissue. Pretense or pretending that everything is fine can address heart, bone, and small intestine issues. When the immune system and energy system gets disrupted, this starts to confuse our autonomic nervous system, our accelerator or brake. If your accelerator is constantly going, you're in sympathetic dominance. If your brake is stuck, you're in parasympathetic dominance. And if you're constantly going back and forth, again, brake, accelerator, eventually you're still going to wear out the parts and be stuck in one mode or another. All of the stress creates chaos for our nervous system. And we know definitely that there's a feedback loop between the endocrine and nervous systems. And if we don't pay attention to, again, this feedback loop and how important it is, you're not going to be able to get your patients or your clients feeling any better. Sometimes when I give this talk to just a general consumer population, when I say the word hormones, most people think I'm just talking about their libido and reproductive function. But I'm really talking about the immune system and energy hormones like the ones cortisol, DHEA, adrenaline, pregnenolone, thyroid hormones, pituitary hormones. And also about neurotransmitters. These are the chemicals that make us feel good. Again, if we don't address hormones and neurotransmitters in the overall program to get people back in balance, you wind up with a population that's chronically depressed and chronically anxious, or a combination of both. And I'm sure all of you are seeing a lot of that in your practice, as I am. When I spoke of other under the grouping to say, what causes people to get out of balance and keep them feeling sick and tired all the time, according to the laws of quantum physics, we now know that thoughts create our reality. Emotions can produce chemical responses in the body. In fact, there's a great book by Dr. Candace Pert. She wrote Molecules of Emotion, Why You Feel the Way You Feel. And I actually used her book in my PhD thesis. She's the person who discovered the opiate receptor on the brain, and she goes into a lot of detail about how emotions can create these chemical responses in our body. So if your clients or patients or people that like to read, again, that might be a good suggestion for them to understand how their bodies are working and why these things are wreaking havoc on them. I find also, too, in my practice, when someone's spirit is compromised, whether they're dissatisfied with themselves, whether they're unhappy with their job or their relationships, finances, or their life purpose, again, this will take a tremendous toll on why they're constantly still feeling sick and tired all the time. And then, as I've mentioned before, all the biofield, the bioelectric and electromagnetic energy that's surrounding us can constantly wreak havoc on our systems, too. When you understand all the different things that can be contributing to your clients or patients not feeling well, if they're doing all the right things, they're exercising, if they're eating right, taking medications, et cetera, then you might want to look at some of these underlying causes and start addressing them. And now that you know what some of the causes are, I'm sure you'll want to know, well, what do you do about it? The way I start all of my clients out after I do their initial consultation, I try and assess what types of toxins are in their system, and then I begin doing targeted specific detoxes. I use Renew Life, brand line for, it's not changing again, I'm sorry. Renew Life for Candida Cleanse. I use Dr. Nature's Colinex for Parasite Cleanse. I use, again, Renew Life for Heavy Metal Cleanse, and that really is a difficult one. I suggest you do that at the end or make sure all of their amalgams are out because they will really get very ill trying to do a heavy metal cleanse. And then for environmental and chemical cleanses, I use standard process systemic purification one. I don't know if any of you are using any of the standard process products, but they're very, very good. If you're not sure if your client or patient has any heavy metal in their system, you can also do hair analysis testing. One of the companies I use is Trace Elements. They will do the hair analysis for you, send you the report, but you need to pay special attention to the results because sometimes they can come back and say that there really isn't that much heavy metal in the system. If you read the work by Dr. Andrew Cutler, he has a book out called Hair Test Interpretation, and there's a condition called deranged mineral transport. Sometimes the results are inaccurate, and there is a formula in this book. If you read through it, you can apply that to the hair analysis test, and you can see if your client or patient falls in that category. Then you know that the results really are not that accurate, and you still may want to consider doing a heavy metal mercury detoxification. If you're not familiar with doing detoxes and working in this fashion, and especially if you have clients on a lot of pharmaceutical medications, one of the best things that you can absolutely positively do is test them for food sensitivities. And if you can get them off of some of the foods that are creating the chronic inflammation for them, you really will do a tremendous service as far as them feeling a lot better quicker. I normally test for food sensitivities after I've done the detoxifications because with certain toxins in the system, certain foods will come up positive. For instance, people that have candida will test sensitive to candida. People that have parasites will normally test sensitive to a lot of the cow's milk and goat's milk and sheep's milk products. But again, if you're not familiar and you don't work with a qualified practitioner in your area and you're not familiar how to do these things, then just start with food sensitivity testing right off the top, and you can start to get a lot of success for your clients' and patients' well-being. As I said earlier, one of the biggest complaints I get from my clients are, I'm sick and tired of feeling sick and tired, but one of the other complaints is I can't lose weight no matter what I do. And this is where a lot of these detoxifications and food sensitivity elimination come into play. When people do a candida cleanse, usually within 3 weeks they will lose anywhere from 6 to 20 pounds. When they do a parasite cleanse, anywhere from 10 to 40 pounds over 4 weeks. I know that's extreme, but it really depends on how toxic somebody is. When they eliminate the environmental and chemical toxins through systemic purification, they can lose anywhere from 7 to 21 pounds in 3 weeks. So that's a lot of weight. But again, a lot of these things are the reasons why people can't lose weight. So when you start to get rid of the underlying causes, weight management also becomes a lot easier and a lot easier to maintain going forward for all of them. After I've done those segments, I normally try and see if somebody will rebalance on their own, give them a couple of months, and if they start to feel a lot better, which usually I will say this, the first consultation that I have after their initial consultation is usually about 4 to 6 weeks. And if they've done one of the cleanses, especially candida, by the time they come back to me, they will normally already feel 60 to 70% better. And that's just with one detoxification. So again, these detoxes and eliminating sensitive foods, very, very effective in short term. But I give them a couple of months, and if I still see that they're having problems and feel that hormone testing and neurotransmitter testing is necessary, then I use a company called Saber Sciences in California. They're excellent. I have been with them since 2002. They do saliva hormone testing. For men and postmenopausal women, they'll do a 24-hour circadian test, one sample every 4 hours, 24 hours around the clock. If it's a menstruating female, they will actually test her over 24 days. So it's a very, very comprehensive test system. Neurotransmitter testing, of course, is just the one test for urine. And they will give you the results. They will interpret it for you. But the brilliance of this company is that they will custom blend hormone creams and neurotransmitter creams for your clients or your patients. They use bioidentical hormones. The custom creams will contain, I've seen as small as micrograms in some of the hormones to double-digit milligrams. It is very specific for the person. People that are taking DHEA, pregnenolone off the shelf, we all know that if you take too much of a hormone, you can turn your switch off. If you don't take enough, you're not going to have any effect. And with this particular company, like I said, they will gear it to the individual based on their results. Testing is advised 4 to 6 months down the road, and the goal is to get the system rebalanced and get them off of the custom cream. But if any of you aren't using this type of service, you have no idea what a tremendous benefit it will be for your practice. After we've done all of the detoxing, all of the food testing, and the hormone rebalancing, it's still very important for clients to continue to be monitored and to see how they're doing. And I work very closely with their medical practitioners, making sure that they continue to get standard blood work. There's a lot of information that can be gleaned from things like a comprehensive metabolic panel. You know, look at the ALCAT. You can get information on whether or not there's heavy metal or digestive inflammation going on there. CBC with DIF can give you indication for parasites. Of course, you know, thyroid, TSH hormone testing, cholesterol, liver function, all these tests, standard blood work, you can really get a lot of information, especially C-reactive protein. If you see a lot of inflammation going on there, you know, you've got definitely toxins, probably food sensitivities. And hemoglobin A1C, you know, check for early signs of insulin resistance and metabolic syndrome. When you've done everything as far as you can physically for your clients or your patients, if you already do or you know someone who does any energy work, again, that's another area in which I prefer to work with my clients. The two disciplines that I use are Integrative Energy Therapy and Jinshin Jitsu. Integrative Energy Therapy is a discipline that removes negative energy from the DNA memory and replaces it with positive energy. And Jinshin Jitsu is an ancient Japanese healing art where you basically work as a facilitator to open up energy channels that have been shut down, much like when a circuit breaker pops. I do not suggest the energy work up front with my clients right away, because if they're in the same mindset and you work on them and they go out the door and they still have the same negative thoughts, they're not going to get that much benefit. And when they feel really tired and when they feel really lousy, again, they're not going to get as much benefit. So I start to work with them on the physical stuff, and we get to the energy work later on. But things that I suggest up front as far as energy clearing and energy balancing is you can get them to start taking some Epsom salt and baking soda baths, about 2 cups of each in the standard tub of water. Epsom salt draws out toxins, and baking soda cleanses the auric field. I also tell them to try using some essential oils, especially sage and cypress. Both work very well for cleansing the energetic field and then uplifting the mood. You can get those, you know, standard health food stores carry them. For the electromagnetic energy that's surrounding all of us, I am a big proponent of using Himalayan salt lamps. And you can get them online too. I have, I have them all over my house. I have them in my office, and I actually make a lot of my clients consider getting them when I know they're going to be around a lot of electromagnetic energy all the time. In addition to the physical things that I do for clients, working with them on their energy and emotional levels, I also have a reading list, and I make some suggestions for books, DVDs, CDs, etc., based on what's going on for them. My initial consultation involves not only their physical history and their family history and their health history, but I get a lot of information about them as a person, about their life goals and their dreams, and find out a lot about what's been going on with them emotionally in their present and in their past. And based on that, again, I make a lot of suggestions for different books. And I have a reading list, and any of the companies that I work with, my reading list, I'm happy to provide for anybody. Just ask for it. I'm happy to send it to you. Even for the Candida cleanse, I can, protocol, I'm happy to share. And I also have a very special diet that I'm willing to share with anybody that's interested. So after all that, basically, I said I use nothing artificial. I try not to have people on supplements, try and get them better. But do I actually use supplements? Exactly. When somebody asks me what's the most important thing I can take, I always jokingly say, take responsibility. But past that, I understand that people do need some support. And I am not adverse to anybody using, vitamins, minerals, herbs, amino acids. I use them in my practice. Homeopathics, protomorphogens, again, very specialized companies. Standard Process makes excellent products. Another company, Guna, that I work with that does the physiological regulating medicine, they have excellent products. Custom bioidentical hormones and neurotransmitters, as I said, from the organization Saber Science. Other things I do for my clients is to do some research for them. They may want to know, is this a good thing to try, or is this a good route to go? And, also product research. They'll say, is this a good product or not? I know it's a lot of work, but one thing I will say, if they're not getting the answers from us as their practitioners, then they're getting them from the checkout people in supermarkets. I've been told that, oh, I take this, what do you think of it? And I'll ask them, well, where did you hear about this? And they'll say, the checkout person at the supermarket said it was a good product. So, as practitioners, we have an obligation to do what we can for everybody to get to the cause of their problem, as opposed to, like I said, slapping Band-Aids on their bleeding arteries, to eliminate as much from their system that is wreaking havoc for them, and to get them back in balance. However, they have to do the work. All you can do is educate them. So basically that's it. If anybody has any questions, I'm happy to answer some questions now. Hold on. I don't know this chat box.
All right, hold on just a sec here, Dr. Scalise. We're opening up the box. And we'll go through them here in a moment. All right.
Dr. Scalise, ask her to give us information.
Oh, actually on the first slide.
Let's
go back to the first slide. All right, we'll go back to your first slide, which I believe had your contact information. Somebody's requesting that.
Okay.
To get your Candida cleanse and diet info. Here's the first slide. This is for Elisa K.
Oh, you want to let people know if they have any other questions, they can type them in.
Sure. If anyone else has a question, there should be a question box on your dock there, and you're welcome to just type in the question, and that should pop up on our end here. We'll just wait a minute or two to see if any of you are entering questions.
Also, too, if they want to contact me by email, which I see is not on the slide, we didn't put it on there, but if they go through you, you can just forward them to me, and I'm happy to get back to them.
Okay. You can contact our main email, which is info@alcat.com, with any questions for Dr. Scalise, and we'll forward them on to her. Let's just do one more quick check with the question box here. I don't see any other. Oh, what was the name of the lab in California that you used?
It's called Sabre Sciences, SABRESCIENCES.com, and I will give you their phone number. It's 1-888-490-7300. And it's SABRE Sciences, SCIENCES, INC. Wonderful people, excellent, excellent, excellent work they do.
Great, perfect. All right, I don't think there are any other questions right now, Dr. Scalise.
Okay.
But if there are, we will definitely forward them on to you.
Great. Thank you very much, and have a good night.
Thank you so much, everyone else, for joining us.
Bye-bye.
Bye-bye.